There's my name, my affiliation. We can skip that. You've heard it. Here's the required slide about well water issues in Maine. And I'm saying, I know it's not a contest, but 57% of households, we believe that to be the highest per capita in the country. You can disabuse me of that if I'm wrong. Keep in mind, our total population is 1.3 million, so you can take that for what it's worth. We think that's about 750,000 individuals on wells in Maine. I'm not gonna read the rest of the slide, except for to point out that bottom line is something that we focus really heavily on in our public health agency, that only 48% of people with wells in Maine have tested those wells for arsenic. And that's kind of the driving data point behind much of what we do in our state public health department, keeping in mind that we, like many of you, we don't have a private well water program either. We don't even have county health departments. We have me with my 0.15 FTE and 2 toxicologists who answer the phone about 600 to 1,000 times a year to take questions from well owners about testing and treatment. But what we do have, and what I'm presenting on today, is an environmental public health tracking grant. And that has been a huge boon to us in the state in terms of our ability to track well water quality and testing in our state, and then leverage that data to, with chewing gum and fishing line, put together bits and pieces of education and outreach to try and get that 48% higher and higher. And our goal right now is to get it up to 65% by the year 2020. So quick, if you don't know about the Public Health Tracking Program, it's a CDC program. They give us money in all those states that are green in New York City. Briefly, our main business is to come up with nationally consistent data and measures about environmental hazards and health outcomes, and then publish those data on data portals. And so the national network has a portal, each state has a portal, and then because each state has a portal, we can also be in the business of coming up with state-specific data that are related to public health priorities. In Maine, with 57% of households on well water, we see this as a really good opportunity to leverage this data portal for our uses for this public health issue. So this talk, I think, is originally conceived was going to be like a live demonstration. We're going to go to screenshots because the Wi-Fi is not so great. So bear with me on that. This is just if you go to our main tracking network, the URL is there, you'll encounter this homepage. This is where we can tell stories, let people know we've updated data, give people a taste of how data are being used for public health action. We're going to take a look at one of the stories that we put up in January, just to let people know that we had updated our survey data that are available in our portal. And hopefully you come and read this and you're so intrigued, you say, I've got to go check out this data. So you click on that green button at the top. You come to our index page. Here you can see all the different content areas that we make available within our data portal. The private well water content is actually one of our flagship content areas. We duke it out with our Lyme disease data for popularity. And our Lyme disease data is great. It's really popular. It's not as robust as our private well water data, and so people end up spending a lot more time investigating and exploring the private well water data because, as I hope you'll see in a minute, there's a lot to check out. So we're going to zoom through. Everybody knows how to work websites. We're just going to pretend that we know where we're going, and we're going to go check out the maps. This is going to look a little bit like the Stevens Point, Wisconsin talk you saw earlier, and the Louisiana talk. And so now it's time for Maine maps. And the red circles are just showing you where the navigation is going next. So our main map display, this is really, again, some of our most popular data displays within the content area. And we curate this default display for users. And sometimes we curate things because we just want people to know there's interesting data to explore in the portal. And sometimes we curate things to tell a story because it's relevant for policy debates or some other topical issue that's happening. And this default display is a little bit of both. And so in the past couple of years, there's been a lot of discussion about what do we do to get more people to test their well water and to protect themselves, particularly from arsenic exposures. But the right-hand map there is also really exciting to us because, you guys who are working with rural populations, it's really hard to get, sub-county data. And so here we are, we've got this really nice town-level map of percent of wells that exceed the state, or excuse me, that exceed the 10 ppb MCL. And that's new and novel and interesting, especially for us in Maine. And so we're trying to advertise that and then guide people, get them starting to think about what they could learn from this tool. And so just real quick, the left-hand map, the data source is our behavioral risk factor surveillance survey. So for you non-public health people, that's a public health survey, random digit dial, telephone survey. We add 3 questions to our state module on that, and we've been running those questions every couple of years, and actually now every year, and that's our main metric for the evaluation of our program. How many homes with wells are testing for arsenic? The data source for the water quality data in our data portal is a data set of about 50,000 well test results that have been analyzed at our state public health laboratory, real world private well water test results by real people. As Aaron said, it's real drinking water. And so it's not random, it's clearly biased geographically. The state lab is in what they call central Maine, but it's really kind of, all that gray area on the map is like moose and blueberries and potatoes, and 4 people. So, we don't have enough wells to fill in a lot of our maps. We only present data for towns where we have 20 or more wells sampled. Okay, so that's the data source. We allow you to drill down. I'm going to skip through some of this and just get into the real meat here. We just zoomed through into the well water quality topic area. And so things I wanted to point out are the way we present the data for, we have 6 different contaminants of concern. That first slide, I talked about arsenic and uranium. We also have fluoride, we also have manganese, we also have uranium, we have radon. We don't have radon data in our portal yet. We're working on it. And we've got to figure out, does it belong in the private well water area? Does it belong on its own? Because we'll also have air results for that. We have a number of different measures that you can explore. So this is actually showing you the context of how many wells, how many sources are in our data set. And so you can get a feel for the spatial distribution of the wells in the data set. If we switch to, this is that map that originally came up. So the percent of wells that exceed the 10 ppb. And this allows you to, now look at this map and think about the patterns and the distribution and the clustering, which is really interesting. We also provide you with the maximum. Okay, so you ready for this? Yeah. So normally if we were in the data portal, we would hover over these towns and these concentrations would pop up. But this is, so Danforth is the highest concentration that we have in our data set. It's pretty amazing. And then you can see that pocket on the mid-coast where there's all these towns that cluster with these really high levels. I live in the county that's circled with the red circle, and so I'm gonna just take us and zoom in there for fun. So this is Cumberland County, and I've just pulled up a map, a town-level map within the county. Our mapping is not the sort of interactive mapping yet. We're working on that. We just haven't satisfied ourselves that it's as user-friendly as we want it to be for some of the partners that we think really rely on this tool. So here's the same percent of wells that exceed the 10 ppb for Cumberland County. And if I'm a community-based organization, because again, we don't have county-based public health, I can look at that map, or if I work in a municipality and I can say, this is really interesting, this can really help me think about where I need to be working, what messaging I need to be putting out there when it comes to private well water education and outreach. But if I live in Cumberland County, I also think, I feel like I've heard about uranium in well water in Cumberland County, so I'm gonna check that out. And so sure enough, I can pull up the map of uranium in Cumberland County, and I can see, now I have this much more rounded out picture of water quality issues in the county. And I can do that for all 6 of those contaminants and all of those measures, and continue to sort of understand more and more about water quality in my area. And so here's, again, just the maximum, again, just to underscore the point that you can really dig deep into the data that we have. One of the other principles of tracking in these data portals is to provide the user with multiple ways of interacting or visualizing the data or getting the data. And so we have mapping, but we also have tables and charts. And we don't have it for private well water. Many of our content areas have trend charts. So we're going to actually go look at tables really quick, just to give you a feel for what information is available there. In our tabular displays, you can get a lot more information, and you can slice and dice things for different purposes. So here you've got a table that has all the measures for arsenic in one table for towns, and you can select all towns. You can just take the top 10. You can sort it by analyte. You can you can sort it by measure or location. And so here you can see Manchester comes in at a whopping 60% of wells in that town that have been tested. So of the 200 and almost 300 wells that have been tested, 60% of them were greater than 10 ppb. Which is interesting. And so you can manipulate that table however you want. You can also switch the table. And now you can look at one measure for all of the analytes. So now I can see, okay, so Manchester, I know, has this arsenic issue, but they also look like they have a little bit of a uranium issue. And I could sort this table by fluoride if I wanted to find out where do we happen to have a fluoride issue. And I could keep doing that. And if through this portal, we've been able to discover things that we didn't even know. We were the experts, but until we had the data available at our fingertips to manipulate in this way, we didn't know where the town with the highest fluoride concentrations was. And we found that out. Actually, Scientific American did an article a couple years ago about fluoride in water, and actually through the process of working with that reporter and using our portal, we were like, well, we've got a fluoride pocket up in the down east area that we didn't know about. Now we've explored water quality a little bit. Let's go back and look at the sampled survey data, that BRIFIS, Behavioral Risk Factor Surveillance System data, and look at the homes with private well water. And so this is where that 57% came from on that first slide. It comes from our sampled survey data, which the portal is showing you here. You can see that over time we've creeped up, which is interesting. I don't know that I have a good answer for why that is, but there it is. You can see that with the selection tools on the right, you can slice and dice that for years, for different geographic levels. You can look at that by owner-occupied or rental status. You can also export the data as a PDF and drop it into a report. You can export it as Excel and manipulate the data on your own, which is pretty cool. Testing behavior, this is again that sampled survey data. So we saw it in map form, and now in table form, we can look at it a little bit more closely and look at all response types, including the don't knows, which are not insignificant here, and that's also interesting to think about. What does it mean if someone doesn't know they haven't tested their well water for arsenic? Does that mean they haven't tested? Is it different among people that had? above the 10 ppb or not. We don't know, but it's something we can keep an eye on, and if we wanted to explore further, we could. We can also do the same kind of exercise in charts. And so here's a nice chart of the same arsenic testing among households with wells by county. We only have 16 counties in Maine as compared to 96 in Virginia. But here I can quickly, like if I'm a legislator, I can quickly come to this chart and say, okay, where's my county in comparison to all the other counties? Where's my county in comparison to the statewide percentage? And quickly come away with a nice clean chart, which then I can also manipulate with those tools on the right. So that's the super quick walkthrough demonstration of our portal. I was just going to finish up with a couple of use cases of how the data are being used, which have been really exciting for us to see. So first, it's being used a lot in the media. There's a lot of public discourse about private well water in Maine, and we've rediscovered arsenic, for the 5th time 2 years ago. And so what's been really interesting to see is that people the media have started to have learned that the portal is there, and they're starting to count on it as a resource. And so when we first launched our data, perhaps our most exciting use case in the media was the Bangor Daily News, which is one of our biggest dailies in the state, did a front page story about arsenic in drinking water and included a lot of our data. They also then did this really nice online feature, sort of New York Times-esque interactive feature, and they actually went into our data portal, downloaded all of our data, dumped it into Tableau on their website, and created this interactive feature, which was great. And they got far more eyeballs looking at that data than we would ever be able to do on our own. It also did actually end up in a huge spike in traffic to our data portal, and the phone was ringing off the hook about, how can I get my water tested, and all those things that we know that happen when there's a nice news story. So that was a nice example. Another use case has been in our policy debates, and I alluded to that earlier. So in the past 2 years, our past 4 years, I guess, we've had 2 kind of major legislative initiatives to try to get more resources directed to well water testing for arsenic in the state. And so on the left there is an advocacy e-newsletter that they took a map and they put it right in, and they're using that to whip up support for a bill that they were backing. There's another headline from a newspaper that featured some of our data. And then I think what was most gratifying was in the public hearings and in the work sessions for this bill that I'm showing the cover there, people were using our data and citing our data for, against, neither for nor against, and we didn't care. We're agnostic when it comes to those things, but it was, probably for all of us in the room, for someone to take your data and use it in a policy debate was it's the dream. It was really exciting. The bill did not pass. But that's another story. It's back in the legislature this session currently, and we'll see what happens. Okay, so there's also a little bit of self-dealing involved in our program, and so we create the data portal. We're also one of our bigger consumers of the data within our data portal, and so this is an image of a targeted direct mail piece that we have developed, and we piloted this based on some survey data that we did with Columbia University that Frida and Dina based their survey work on, and our findings were very similar. And so one of the things that survey revealed was information, local information, anything that can sort of normalize well water testing and water quality issues can be a motivator to testing. And then we did a pilot, and we did 5 different versions of the mailing with different kinds of messages based on the survey findings. And it turns out the one that had the local information performed slightly better than any other version. And so actually we're right now mailing a location-specific mailer to 32,000 residents in the state. They're households with children under the age of 6, and whatever county they're in, hopefully they're getting a mail piece that has information about arsenic and uranium or whatever the next highest contaminant is in their state. And that's exciting. I don't have results to share with you yet, but maybe at a future conference. Similarly, we have developed a location-specific poster and brochure that we borrowed heavily from New Hampshire and some work that they did recently. And so these, the icon design there at the bottom is comes by way of New Hampshire. And you can just see there in the bottom left that we're including that location-specific information. So community organizations, town offices can put these up and hopefully grab more attention. It presents a little bit of a logistic challenge in just managing print runs. And if you have 96 counties, I don't recommend going with this approach because 16 is hard enough. And so we'll see if we can manage it. We're actually, these are at the printer right now, and then we'll be going out in the future. So back to that testing rate, we're going up, which is encouraging. We have more work to do, and this conference has been really great to hear about all the different ideas, and there's a lot to take back and incorporate. So did I do it? That's it? Okay.
Although hopefully there's some questions. It's a really great, you can get lost, just start playing on their site, because it's so cool the way that it makes maps on the fly. It's pretty cool. Any questions? Karyn? Yep, here's one from Aaron.
Hey. I was wondering if you plan to or have you tried to overlay any of your maps with health outcomes? So looking at, so there's a group that was convened by the National Water Quality the National Water Quality Monitoring Group under USGS that ended up getting a little funding looking at arsenic and then overlaying that with some health outcomes data. So that might be something you'd be interested in tapping into maybe.
Thank you. Yeah, there's a lot of discussion in this tracking world about data linkages and things like that, and there's some epidemiological concerns about overlaying those data that we think really hard about, and also, so there's that we haven't yet figured out how comfortable we are with that kind of thing. There's also a technological issue, and so you saw the way our content areas are siloed. We do have cancer data on our data portal. There's nothing stopping someone from pulling up 2 maps, 2 county maps, or soon-to-be town-level cancer maps and looking at those.
Interesting.
But
It's a can of worms a little bit. Yeah.
Exactly.
I have an analytics question
about
your, I don't know if you can answer or not, but I was really curious if there's, I'm Kara Dennis, I'm from Minnesota Department of Health. I was wondering if there's an analyte that's most commonly searched, and I was also wondering if people prefer maps or the tables, or if there's...
Yeah, so I don't know about analytes. I can't drill down that far, just the way that the way the pages are served up we have just actually recently migrated to Google Analytics to look at things. I can look at page views and user sessions by display types. And so, yeah, maps are by far the most popular, especially for private well water. And some of our other content areas like lead poisoning, trend charts are really popular. But yeah, maps definitely are where
people love maps.
People love maps.
I have a question. Is there any overlap between like the CDC Safe Watch programs and the public health tracking programs? Are any
I'm doing that. I don't know.
for Michigan?
So we're going to be I'm in the State Watch community, and I'm going to be using Google as our mapping of our criteria.
Because public health tracking's been around forever.
Yeah.
Yeah, I mean,
So from what I know, that's a really good example. And you guys are new to tracking. Michigan is new. You just launched your portal like last week, right? Yes. Yeah. Yeah. So you know how it is with the silos, and so I forget where the Safe Watch program works. Which center within CDC, in which branch and all of
We got
that.
a couple of folks here. Judy's,
It's in the center, but it's not in the same branch, and so it gets all tricky. We had one of the unregulated drinking water system grants. I can't remember what it was called back in the 2013-2015 grant cycle. Yeah, and our whole program and proposal was about braiding those two resources and bringing those together. And as Jennifer was just saying, there's a lot of encouragement from our federal funders to leverage resources across programs, and we do that as much as possible. Like our childhood lead poisoning prevention program relies completely on our data portal for its basically all of its surveillance and data dissemination. Our infectious disease program relies on our data portal for the dissemination of the Lyme disease data, and there's a lot of examples like that.
it's much more broad.
Mm-hmm.
Any other questions? All right, thank you.
Thank you.